On 5 News, a special report on the growing crisis in the home care system. A former worker speaks out about the lack of training, lack of time and intense pressure.
You didn't have time to talk to them, there was no compassion, there was nothing, you had to just rush out onto your next one.
Also, David Cameron is challenged over his plans for school standards and his own math skills.
What are 9 8s? I do times tables only in the car with my children on the way to school. And I'm going to stick to that just in case I get one wrong.
Alexander Litvinenko's widow tells an inquiry that he feared for his life. Free after 400 days in prison, the journalist Peter Grester vows to help his colleagues still locked up in Egypt. And meet the man who helped Eddie Redmayne deliver an Oscar-worthy performance. Welcome to 5 News, I'm Emma Crosby. It is a crucial service that helps keep people away from our already overburdened hospitals. Now, new claims have highlighted the worrying state of England's home care system. Former worker Gillian DeMeas told 5 News she was given just 15 minutes to spend with each of her elderly patients, leaving no time for anything but the minimum care. Gillian says she eventually had to quit. Our chief correspondent Tessa Chapman has this special report.
Gillian DeMeas' work schedule tells a story of intense pressure and rushed care for vulnerable elderly people. Allocated just 15 minutes for some home visits, she had to cram in as many as 15 appointments in a day.
The morning calls were particularly horrendous because you had to get people out of bed, coax them out of bed sometimes, wash them, dress them, make their breakfast. You didn't have time to talk to them, there was no compassion, there was nothing, you had to just rush out onto your next one.
She's quit her job and spoken out because she feared mistakes could be made, putting her patients at risk.
Doing this in the community is supposedly saving government money because they're not going in homes. I mean, some of these people wouldn't even be alive if they didn't get a care worker. I think the consequences are people probably not get the care they want and will die. I just felt that I was so stressed out and it was just to me it was just a hopeless situation.
We shared Gillian's experience with the Department of Health. They agreed it's unrealistic and unfair to allow just 15 minutes to help people with things like washing, dressing or getting out of bed. We're working with councils to clamp down on rushed visits and have changed the law so they have to consider a person's well-being when arranging their care. But Gillian's former employer told us without money it's impossible. We just deliver what we're commissioned to provide, he said, adding, our hands are increasingly tied. He called for a wholesale review of the health and social care budgets. There's no doubt there is good care, but it costs. 92-year-old Enid counts herself lucky she's able to pay privately. She has 3 visits a week for 2 hours and always makes time for tea and a chat with her carer.
It's important to establish a rapport. There's no point in anybody coming and just rushing in and rushing out, and I don't really know very much about them and they certainly don't know a thing about me.
This is the kind of care our whistleblower wanted to give, but she claims budgets made impossible, leaving the already fragile more vulnerable.
Of course, this is a big issue for all of us and something that all the parties will be discussing around the election.
Yeah, that's right. It's a huge issue. This is all about dealing with the ageing population, and all parties agree ideally they want to help look after elderly people in their own home. After all, it saves the strain on hospitals and on healthcare. This weekend, Ed Miliband said if Labour came to power, they would promise 5,000 more home care workers. We haven't had those kind of figures from the Lib Dems or the Tories, but they say they do have a commitment to social care. Gillian's story, though, is not unusual. There will be care workers, there will be patients watching this who recognise precisely what she says, many of whom will be calling for bigger budgets to make a difference.
Okay, Tessa, thank you very much. The Prime Minister